Um, I'd like to welcome the participants to the closing session. I'd like to note that this is the 20th anniversary of the forum, first hosted by the WHO in Geneva. We have now completed a rich program reviewing the state of play of TB vaccine science, how the pandemic broadly and our work specifically is impacted by the current COVID-19 pandemic, and how we mobilize political leadership and sustainable resources to accelerate the development of and broad access to novel TB vaccines. We are grateful for the contributions of so many people to this virtual global forum, our speakers, our session chairs, and to all of you who joined us as participants and contributed to the discussions over the past 3 days. I would like to especially thank our ECI, or early career investigators and advocates, who brought their perspectives and passion to the forum. I want to particularly thank the organizing committee. This committee was formed to plan the 6th Global Forum on TB vaccines, and they all agreed to serve as the organizing committee for this virtual global forum as well, allowing us to quickly pivot to virtual planning and to provide continuity and context in planning this and the 6th Global Forum. I would also like to thank our planning committee for their time and dedication to organize this global forum. I would like to thank Jennifer Woolley and Hester Coopers for their tireless efforts in organizing and supporting the forum. And finally, I want to thank our sponsors whose support made this virtual global forum possible: CellCarta, DSW, EDCTP, FHI Clinical, and the Bill and Melinda Gates Foundation, NIAID, and Tissues. We have 3 eminent speakers in our session providing closing reflections and looking forward ahead to the 6th Global Forum in Toulouse. With that, I'm handing this over to Mark Feinberg to introduce our first speaker.
Thanks very much, Dave. I just want to echo your comments, and I believe this has been a great meeting, and hopefully one we'll look back on as an inflection point in progress in the global TB vaccine effort and accelerating progress. I'm very happy to have the opportunity to introduce Dr. Eric Goosby, who is a professor of medicine at the University of California, San Francisco. I think many of you know Eric and know of his tremendous reputation in global health. He was the founding director of the Ryan White CARE Act in 1991, which transformed HIV care in the United States. And then focusing internationally, he was the global AIDS coordinator under President Obama, responsible for implementing the president's emergency plan for AIDS relief. He currently serves as the UN Secretary General's Special Envoy in Tuberculosis. For those of you who know Eric, you know him as a visionary and a humanitarian, and someone who's a true champion for driving progress for global TB control. In addition, he's also a really nice guy, and it's my pleasure to introduce Dr. Eric Goosby.
Thank you, Mark. It's very kind of you to have such nice introduction. Thank you so much. Well, what a remarkable meeting. The organizers' vision of trying to convene a discussion that bridges both the scientific status of work as we evolve in our pursuit of a vaccine for tuberculosis, and at the same time weaving in the political and economic barriers and challenges that remain in front of us. I think what a year it's been. And I think that most of the conversations that I listened into over the last couple of days were really reiterating the idea that COVID was breathtaking. It took a year to move from threat to vaccine. And we have seen much slower trajectories with diseases that we all have dedicated much of our careers toward. Tuberculosis, HIV, malaria in particular, and the dodging that those organisms have done in our ability to secure a preventative strategy that includes a vaccine in it. The fact that we had such a rapid movement with COVID reminds us, and in every discussion I heard, there was a regret that why is the tuberculosis burden of disease, the 1.5 million deaths annually, not risen to the view screen of the global community? the political aspects of that, the private foundation aspect of that, and I would say the governments that are responsible for the populations burdened by the disease, tuberculosis, have been unable to place it as a priority. And if they do achieve it for a period of time, to sustain the investment so an outcome can be achieved that changes the trajectory and the numbers that we have looked at for so long. I think that this community coming together, the scientists, those who develop and support medical delivery systems that reach the populations we have targeted, with the political will and with what I want to highlight, a appreciation of the role civil society plays in anchoring this response. COVID can be looked at as something that was generated by an acknowledgement in the media, validated by the science and the scientists, feared by the political bodies that were reacting to it with the population. And those different elements converge to come together to accelerate things that for HIV, for example, took decades to move through our understanding of a natural history, pathophysiology, diagnostic stand-up of diagnostic tests, therapeutics, as well as prevention and vaccine development. We need to, as professionals in the scientific and caring aspects of the response for COVID, for HIV, for TB, for malaria, we need, as those providers, to raise our voices in light of the COVID clarity in need, in articulating a need, and say that this need is also present in tuberculosis, and we need to find ways to put that orchestration of a response for the greater good that we saw with COVID on a line that that centers and focuses on the unmet needs of tuberculosis. As providers and implementers of these services, we can call a challenge to our political leadership and to the G7 and the foundation community, because this is where the resources are going to come, to make that initial investment, commit to the longer haul at an accelerated pace, because of the morbidity and mortality that tuberculosis has and continues to represent to the planet. So I just want to reinforce all of the conversations and I guess the disappointments that were expressed, not because of a desire to not respond to the COVID need, but because we are also intimately aware of the morbidity not responded to and the deaths that continue to occur with an ability to stop them. So many not realizing the benefits of the science that we already know. So with that, Mark, I'll stop. Thank you so much.
Thank you very much, Eric. Great to see you and great to have you participate.
So Eric, thank you so much for your, as always, inspirational and incredibly clear comments. I'd like to introduce Soumya Swaminathan. Soumya was appointed as the WHO's first chief scientist in March of 2019. And she's a pediatrician from India with a globally recognized researcher on TB and HIV. And for that, I think we are all very fortunate. She brings with her 30 years of experience in clinical care and research that has worked throughout her career to translate research into impactful programs. Dr. Swaminathan has been the Secretary to the Government of India for Health Research, Director General of the Indian Council of Medical Research, and has served as the coordinator of the UNICEF and UNDP World Bank WHO Special Program for Research and Training in Tropical Diseases. And with that, I'd like to turn this over to Soumya.
Greetings from the World Health Organization. I'm Dr. Soumya Swaminathan, the Chief Scientist, and it's indeed a great pleasure to be speaking to you at the Global Forum for TB Vaccines, particularly since I've been a TB researcher for most of my career except for the last 5 years or so. Now, I'm going to talk to you a little bit about what we're doing at the WHO to help support and facilitate the rapid development of new TB vaccines. As you all know and are very familiar, the WHO's NTB strategy has very ambitious targets, the 90% reduction in TB deaths and an 80% reduction in TB incidence by 2030 compared with 2015, as well as eliminating all catastrophic disease burden and expenses caused by TB. Now, these commitments have been underscored by the World Health Assembly resolution on the global strategy for TB research and innovation that was adopted last year. Despite all of this, we know that TB is one of the top infectious disease killers. In fact, the world is so fixated on COVID-19 cases and deaths, but it's sad to think that every year, 1.4 million people die of TB. And of course, we have the huge burden of MDR TB and HIV-associated TB as well, with a huge cost to countries estimated at about 12 billion a year. We also know that a large proportion of the world's population, a quarter or so, are latently infected with Mycobacterium tuberculosis. And they do form a pool, or at least some of them are the ones from which future cases arise. Now, research is critical to end the TB epidemic that we've all committed to by 2030, but it's also clear that we do not have the tools that we need. Neither do we have the financing to develop the new tools. And you're all familiar with the slide, which shows that unless you bring in the new tools, the rapid diagnostics, the new therapies, and a new vaccine, that it's very unlikely that we're going to be able to meet the 2030 and the 2035 targets. Now, in addition to the COVID-19 pandemic, one of the things that's happened, of course, is that the gap between the estimated number of people developing TB and those that are reported has been increasing widely. And the pandemic clearly is very much on line to reverse recent progress that's been made towards global TB targets, as well as other SDG targets for malaria, for HIV, for child health and maternal mortality, and so on. Now, in February of 2021, we had reports from 84 countries on TB case notification. You can see on this map that these countries account for about 84% of estimated global incidence. What we note is that 1.4 million fewer people received TB care in 2020, and instead of the expected 6.3 million, we had a report of 4.9 million from these countries. So the shortfall in TB case notification was about 21%. If you look at monthly notifications in the top countries with the largest shortfalls, we see Indonesia at 42%, South Africa 41%, Philippines 37%, and India 25%. Of course, many of these countries have now taken steps to address this problem. And hopefully they will think of ways, and they are thinking of ways to reduce the gap between the estimated incidence and the actual notification, as well as address the issues of continuing treatment in the presence of restrictions on physical movement of people and access to health services. Now, in terms of vaccines, we have 14 vaccine candidates in clinical trials, 3 in phase 1, 9 in phase 2, and 2 in phase 3. These include candidates to prevent TB infection and disease, as well as candidates to help improve the outcome of treatment for TB disease. So both preventive, that's pre-exposure and post-exposure vaccines, as well as therapeutic vaccines. Now, we all know that so far the BCG is only the licensed vaccine that we have for preventing TB, and despite high coverage in part of childhood immunization programs, that there's a very slow decline in TB incidence globally. Now, in 2019, the M72AS01E vaccine was reported to protect against TB disease in a phase 2B trial in adults aged 18 to 50 years with a vaccine efficacy of about 50% in tuberculin skin test positive individuals. Confidence intervals, of course, range between 12 and 71%, and this was after 3 years of follow-up. We need to confirm these findings in a phase 3 trial because this could transform TB prevention approaches. At the same time, the fight against TB probably requires more than one type of vaccine, with different vaccines working in different ways. As I said, pre-exposure, post-exposure, and potentially therapeutic vaccines. So what's really needed here is a prioritization and alignment of efforts, collaboration, data sharing, improving regulatory processes, increased financing, and thinking of innovative ways of advancing TB R&D in order to shorten the time to the availability of effective vaccines. And beyond discovery, we also need broader research in areas of social, economic, and population health impact, which will guide vaccine introduction and implementation. In terms of the WHO preferred product characteristics for TB vaccines guidance, this was produced by the WHO's Department of Immunization, Vaccines and Biologicals, as well as a global TB program. And this was done in collaboration with country, regional, and global stakeholders. WHO has published the preferred product characteristics for a TB vaccine for adolescents and adults, as well as a next generation TB vaccine for neonates and infants, and therapeutic vaccines to improve disease outcomes. These documents they provide guidance on the preferred product attributes that new TB vaccines will need to enable their uptake and impact in high burden settings. Since 2019, WHO has also been privileged to collaborate with the Amsterdam Institute of Global Health and Development and the EDCTP, European and Developing Countries Clinical Trials Partnership, in the development of the first roadmap for research and development for TB vaccines. As you saw, this roadmap was launched during this conference this week. This strategic guidance document informs researchers, vaccine developers, manufacturers, funders, regulators, and policymakers on the key priorities that must be addressed to meaningfully advance the development of more effective TB vaccines. The priorities highlighted in this roadmap chart the way forward in technical areas ranging from the stages of discovery and early clinical development through to licensure, with a line of sight to global deployment. The association of WHO with this document underscores the value and the need for global engagement and outreach to align on priorities. As we look to the future, the effort to sustainably develop and implement new TB vaccines will be accelerated by early consideration of the needs of the late stage stakeholders, such as policymakers, regulatory bodies and users, commercial manufacturers, and financing and procurement agencies. Therefore, WHO with AIGHD and EDCTP plan to continue their collaboration to develop a complementary roadmap for early adoption, commercialization, and implementation of TB vaccines. The overarching goal of the R&D roadmap launched at this meeting and the second planned late-stage roadmap is to provide strategic guidance for the development, delivery, and introduction of effective TB vaccines that are affordable and accessible by all countries that need them. And lastly, to mitigate against a delay in the implementation of vaccines intended for use in adolescents and adults following licensure, WHO is convening expert stakeholders to consider the data and evidence that will be needed to be generated for policy recommendation. So the intent of this WHO preferred policy profile is to provide early guidance so that this data may be collected as part of or in parallel to the pivotal efficacy study to proactively align stakeholders and steps to pave the pathway for global policy recommendation, financing, and introduction. In order to sustain investment in TB vaccines and to ensure that they reach the point of implementation, research into new TB vaccines should not be seen merely as a cost, but as an investment with the potential for high value returns or benefits in the form of a sustainable long-term and large-scale impact on the burden of TB disease. In the context of the phase 2b results of the M72 AS01E vaccine, WHO has initiated a multi-stakeholder process that aims to appraise the full benefits of developing new vaccines. By articulating the full benefit of new TB vaccines at this stage, this process helps improve confidence for developers, funders, and countries in the value of further development of new vaccines that have shown some good positive signals in the proof of concept. The assessment will include appraisal of health gains, for example, the QALYs gained or DALYs averted, healthcare cost savings, social benefits such as health improvements in unvaccinated people, potential impact on emergence and transmission of drug-resistant TB, and overall antibiotic stewardship, equitable distribution of health outcomes, and elimination of catastrophic expenditures related to TB. Productivity gains related to direct health effects as well as long-term productivity gains resulting from overall well-being may also be assessed. It is hoped that the results from the assessment will help to facilitate vaccine development and adoption by making economic information, in addition to evidence from trials about the safety and efficacy of vaccines with respect to clinical outcomes, making this economic information available to governments, funding agencies, as well as industry, international agencies, affected communities, and other stakeholders, we hope will help us to move ahead much more rapidly and get all stakeholders on board to really focus on the acceleration of the development of TB vaccines. Finally, I would just like to end by saying that WHO remains committed to work with all partners in civil society to advance the TB vaccine field with the urgency and the solidarity that it demands. We have seen what the world can do when we come together as one with a common goal and mission. We were able to develop not one, but dozens and dozens of COVID vaccines within a year of the identification of this new virus and the making public of its full genome sequence. So I think when we decide that we want to do something and the world feels that it is an important priority and we come together to do it, it can be done. Why don't we try and do this for TB vaccines? Thank you very much.
Let me thank Soumya for her remarks and add thanks from all of us for the global leadership Soumya has shown in responding to the current pandemic. So we've now come to the end of the virtual TB vaccine forum. And again, let me express our gratitude once more to all the speakers, to the chairs, to the organizers, to the sponsors, and a big thanks to all who participated in the forum for your engagement throughout these 3 days. It's been very, very, very. We very much look forward to the 6th Global Forum on TB Vaccines, which will be hosted in Toulouse, France, under the high patronage of Mr. Emmanuel Macron, President of the French Republic, and under the patronage of Dr. Olivier Veran, Minister for Solidarity and Health. And it's our honor and my great pleasure to invite Dr. Olivier Veran, French Minister for Solidarity and Health of the French Republic, to close this meeting.
Mesdames et messieurs les ministres, chers collègues, mesdames, messieurs, c'est un honneur de pouvoir me joindre à cette 6e session du Forum mondial sur les vaccins contre la tuberculose. Je sais que vous avez eu 3 journées d'intenses échanges et je me réjouis de pouvoir les clôturer. La période actuelle de crise sanitaire mondiale que nous traversons ne fait que souligner la menace que constituent les maladies infectieuses pour l'humanité, responsables de millions de morts chaque année. Nous devons reconnaître que la mobilisation pour la prise en charge des maladies infectieuses, et notamment la tuberculose, a malheureusement été affectée par les efforts intenses déployés à tous les niveaux par les gouvernements, les chercheurs, ainsi que l'ensemble des parties prenantes dans la lutte contre la Covid-19. Vous le savez, le 18 juillet prochain sera le centenaire d'un événement historique, celui de la première vaccination contre la tuberculose chez l'homme. C'était à l'hôpital de la Charité à Paris, fruit de la recherche à l'Institut Pasteur de Lille. Depuis lors, nous pouvons bien sûr nous réjouir de la vaccination de plusieurs milliards d'humains grâce à la distribution du BCG avec une couverture de plus de 80% au niveau mondial. Le BCG a permis de sauver des millions de vies. Il a contribué à diminuer drastiquement le taux de mortalité infantile, toutes causes confondues. Comme vous le savez, c'est aussi une maladie sociale et un marqueur de développement dans nos sociétés, car même si la cause est biologique, les facteurs de risque de cette maladie restent très largement corrélés à des déterminants sociaux, en frappant les personnes les plus vulnérables. Ainsi, malgré 100 ans de vaccination massive avec le BCG, la tuberculose n'a pas été éliminée de la planète. Plus que cela, comme vous le savez, la tuberculose reste au plan mondial une cause importante de morbidité et de mortalité. C'est l'infection la plus meurtrière, avec chaque année environ 10 millions de nouveaux cas, dont un demi-million de cas multirésistants aux antibiotiques et 1,5 million de morts. D'une façon générale, et pour des raisons multiples, le vaccin présente une efficacité trop variable pour prévenir les formes pulmonaires transmissibles de la tuberculose selon les populations et les zones géographiques. Investir suffisamment dans la recherche vaccinale, en mettant l'accent sur la recherche fondamentale, constitue une clé du succès. C'est indispensable pour obtenir les résultats à la hauteur des enjeux qui nous rassemblent. Je souhaite à cet égard saisir cette opportunité pour vous renouveler l'engagement qui est le mien, qui est celui de la France, dans la lutte contre la tuberculose. À travers d'abord notre implication au sein des organisations et initiatives internationales, que ce soit en tant que deuxième contributeur mondial au Fonds mondial de lutte contre le sida, la tuberculose et le paludisme, ou en tant que membre du conseil d'administration du partenariat Stop TB. À travers ensuite les efforts de recherche internationale et européenne au sein desquels nous sommes très impliqués. Je pense à la fondation TBVI pour Tuberculosis Vaccine Initiative et aux nombreux projets européens soutenus par les plans cadres successifs. Plusieurs vaccins issus de ces travaux sont en phase d'études cliniques, dont l'un est issu de l'Institut Pasteur. Tout cela est source d'espoir. À cet égard, je sais combien la communauté scientifique est mobilisée afin de répondre aux besoins de vaccins plus efficaces que le BCG pour envisager d'éradiquer la tuberculose, dont la pathogénèse est bien particulièrement complexe et dont on ne saisit pas encore complètement les mécanismes de protection vaccinale. Je la remercie pour son engagement et sa persévérance, car c'est un travail de longue haleine. La pandémie de Covid-19 a également donné l'occasion aux chercheurs de travailler rapidement ensemble et d'adapter leurs recherches sur la Covid-19. Les diverses recherches vaccinales viennent en effet mutuellement se renforcer. Celle contre le SARS-CoV-2 a très probablement profité à l'ensemble de la recherche de vaccins, y compris celle contre la tuberculose, là où les travaux sur la Covid-19 auront permis de lever des barrières pour des stratégies qui seront testées contre la tuberculose, dont les vaccins à ARN messager. Au niveau national enfin, avec la mise en œuvre en lien avec les acteurs locaux de politiques publiques sanitaires fondées sur la prévention, afin d'éviter la transmission et qui ont permis dès 2007 de retirer le BCG des vaccins obligatoires chez les bébés. Ce savoir-faire, cet engagement et plus encore cette mutualisation de nos connaissances et de nos efforts dans un but commun sanitaire sont précieux et doivent être soutenus avec force. La France amplifiera encore davantage ses efforts de soutien à la recherche et développement sur les vaccins antituberculeux en tant que bien public mondial. Plusieurs candidats vaccins français sont d'ores et déjà en phase préclinique d'études. Mesdames et messieurs, c'est avec un grand honneur que la France accueillera pour la première fois en 2022 le Forum mondial sur les vaccins contre la tuberculose, 2 décennies après sa création. Placé sous le haut patronage du président de la République et alors que la France présidera le Conseil de l'Union européenne, nous entendons faire de cette rencontre une réussite collective. Soyez assurés de la mobilisation continue de la France dans la lutte contre la tuberculose. Je vous remercie.